Welcome back to the Femme FC Podcast. Today I'm joined by Mack, who is the Exercise Physiology and Biomechanics Lab Coordinator at John Carroll University in Cleveland, Ohio. She's also adjunct faculty at John Carroll, owner of CLE Sports PT and Performance, and coordinator of sports medicine and performance for Beaumont School Athletics. Carroll graduated from Duquesne University's PT program in 2006 after playing 4 years of varsity soccer. She is a board-certified specialist in sports physical therapy and a certified strength and conditioning specialist, specializing in end-stage rehab of soccer athletes, female athletes, and runners. Prior to her current role, Carroll was the lead of Cleveland Clinic's MatchFit Soccer Performance Enhancement and Injury Risk Reduction Program. She has served as chair of the American Academy of Sports Physical Therapy's Female Athlete Special Interest Group and chair of educational programming for the Academy. Most recently, we had Carroll at the Elite Soccer Rehab Conference, and she gave a similar presentation, and I really enjoyed it. Had a lot of takeaways for me, and so really wanted to have Carroll on. So thanks so much for coming on, Carroll.
Thanks for inviting me, Nicole. I appreciate it. It's great to see you again, and I'm glad my presentation was useful.
Yeah, it
It was
was
fun.
great. Awesome. So would you mind just giving a little bit of a background on your journey outside of just your bio, your current role, the work you do at John Carroll, and some of that more context for setting up this presentation, or this
Yeah,
discussion?
definitely. Yeah. So like you mentioned, I worked at Cleveland Clinic for a number of years. That was my job, like right out of college. I worked there for about 9 years, and then I left and started my own private practice, like a cash-based kind of sports performance and PT practice. And then in 2017, while I was running that practice, I started taking care of a local high school. It's an all-girls school, so I see very much female athletes there. We don't have football, so we have, like soccer. Actually, our soccer team is playing for the district championship this weekend, and cross country, basketball, those other sports. But soccer's been always been my background. I started teaching adjunct, just a couple classes here and there at John Carroll University started during COVID, and then turned into a full-time thing last year. We put in a brand new exercise science lab. So we have a biomechanics lab that has like a Vicon motion capture and force plates and a lot of really fun toys to play with and use for research and for teaching, and VO2 max testing equipment, anaerobic power, body composition, all those things. And so my role there is I coordinate the lab. So I coordinate everyone who's using it. So other faculty who are using it for research. We do testing on a lot of different populations at the university. And then it being a D3 college, they don't typically have like sports science support. So we give, data collection, sports science support, like we were doing the GPS tracking for the women's soccer team. We do their strength testing throughout the year. We support some of the other sports like that. So it's been a really, really fun role. Also starting with some research projects of our own.
Awesome. And so, as I mentioned, you spoke at the Elite Soccer Rehab Conference last year, which, by the way, next year for listeners is rebranded as the Soccer Performance Support Summit, being put on by Femme Football Collective. It's in New Jersey in June. It's a great time. Come out. But you gave a presentation about what we know and what we don't in training female athletes, essentially, and talking about where are the research gaps, but then also where is there research and what implications does that research have for how we're training female athletes? So would you mind just kind of diving in a little bit into what the current research landscape looks like in terms of what we know and what we don't about training female athletes?
Yeah, right now, unfortunately, there's not a ton of research. There's some really great emerging research, and we'll probably talk about that as we go through. But so there was an interesting study that looked at journals like AJSM, American Journal of Sports Medicine, British Journal of Sports Medicine, Journal of Sport Science in Medicine and Exercise, like some big name journals. So from 2014 to 2020, 6% of the studies that were published, 6% of subjects were female, 31% were male. in terms of like just studies looking at just one sex versus the other. So that number is not great. But there's a huge push for one to have more research on female athletes and then also to kind of clean up the methodology because there's a lot of things that we probably need to do better in terms of how we classify females versus males and what kind of comparisons we're making between groups. So we're at a really good time where there's going to be a lot coming out.
So let's start a little bit with some of the maybe misconceptions that there are around training female athletes. Anytime there's a gap in the research, there's a propensity for myths and for hypotheses that maybe end up not being fully accurate or theories to come about. So what have you seen or heard in terms of some of the misconceptions around training women differently than men?
So I think to me, they fall into two kind of main categories, at least in my head, because that's kind of the space I operate in, exercise physiology and biomechanics. But there's some physiological differences where women actually may have better recovery times and less time to fatigue. I'm sorry, greater time to fatigue. We take longer to fatigue versus men, which is really exciting. And then actually there's some the biomechanical differences that we thought were there with planning and cutting and jumping and landing actually may not be there may not be as big of a difference as we once thought. So it's almost, there is kind of a difference emerging physiologically, but then biomechanically that difference is not as big.
That's really interesting because the biomechanical differences have been cited as the cause of anything from ACL injuries to, you name it, any kind of injury that a female athlete might get. Kind of the biomechanics has widely been cited as this is the reason female athletes don't know how to cut or land or decelerate. So what is some of the research around the biomechanical differences in planting and cutting versus just simply individual strategy and movement patterns? What are we seeing emerge in the research now?
What we're seeing is there's a huge variation in individual patterns, and that is with females and males. So when we look at when we compare the two, I'm sorry, most studies compare females versus males, those two groups. But when we look at the inter-individual variation between the groups, there's a huge difference and there's a huge range and there's a huge standard deviation of the values of like joint angles during cutting and planting for one, between females within that group, but then also within males. And the issue with a lot of these studies too, when we talk about methodological wow, can't talk today, methodological quality is that, a lot of times the training age and the skill level are not listed. And so we think that some of that might be because, you have elites and recreational athletes all, within maybe a group for research. We don't know. It's not really been listed. That is the other thing. So what we're seeing is when studies are looking at like recreational athletes, there is a bigger difference between females and males in terms of their biomechanics. But once we get closer to the elite level, there's not much of a difference at all. Now, elite athletes are still tearing their ACL, but to me, that says we have to look at other risk factors for that injury.
And what other risk factors would you think about looking into outside of the biomechanics then?
So there's a couple of really interesting things emerging. So one is we used to think ACL size was like a non-modifiable risk factor for injury. Like people with smaller ACLs tend to tear them. Women technically have smaller ACLs. And there's some really interesting evidence coming out that shows that the ACL can actually hypertrophy with loading. So when they look at divers and there's a study that looked at divers and figure skaters who habitually loaded one leg. So there's always like a takeoff leg or a figure skaters takeoff and landing leg. The ACL is bigger on that side. And there's also some evidence in weightlifters that versus controls that there's larger ACLs. And the thought is that maybe quad strength. So quad strength and loading maybe linked to that. There was another study actually in women's college soccer that throughout a season, the ACL actually, the mean difference of the ACL was bigger by the end of the season, which is fascinating. So there is that's a risk factor that we kind of thought, before, we can't change that. So let's work on biomechanics, really maybe looking at that. There's also, which I find interesting, there's some evidence for like a fatigue failure relationship with the ACL, because when you think about it, it's that same plan cut movement that an athlete might have done, how many thousands and thousands of times throughout their career, and they did it fine. And then there's just that one time during a game or practice, and most often a game, that it goes wrong. And so there is some research coming out looking at fatigue failure. There's studies done in cadavers where they will load, an ACL at a certain rate versus another ACL, and then that loading rate is the only difference, and the ACL will tear with either greater loading itself or more cycles of the submaximal loading. So that's an interesting. There's not a ton of research on there yet, but to me that's a fascinating area. We actually are looking to study in our athletes, like this week, submitting the grant to look at MRI of preseason and postseason of ACL, and then comparing it to the GPS data to see, how much running they're doing and how much load they're doing, because a lot of these studies don't have a load associated with it, so we don't really know like what has prompted these changes other than there has been some load.
Yeah, that's such a great point. There's actually a study I really like in downhill skiers. Christian Fink over in Innsbruck, Austria did this, where he did some serial MRIs of skiers over the course of the competition season and found changes in the ACL throughout the course of the season. And it's definitely something I've thought about, like in more and more congested schedules where, as you're saying, the ACL can hypertrophy and adapt to load, but just like any other tissue in the body, it needs that adaptation period. It needs that recovery period to create adaptations. And if we're just loading and never allowing that, it's not the acute fatigue, because most ACL injuries occur in the first half of games, but maybe it's more of that chronic fatigue of it and the cumulative fatigue over the course of a busy season. So I'm really excited for you to do that research, because that's definitely an area that I've been thinking a lot about since reading that article a couple of years ago.
Yeah, that's good to know about the other article on skiers too, because yeah, I mean the soccer article along the same lines of what you're saying is that soccer article, they saw an increase in the ACL size, but 10% of the knees had edema on them by the end of the season. And it was a non-significant number, but there was the presence of that. Some knees actually started at the season with that, but we don't know what they did in preseason. But then other knees had that progressively. And when you look at like other ligaments, like the ulnar collateral ligament in baseball players, like that's a lot better studied, but it is a ligament. And you think about how those injuries develop with, now we have pitch counts in those athletes. And you're right, like as those schedules become more congested, you just have to wonder what that's doing to the structures of the lower body.
Yeah, and in terms of injury prevention then, or injury risk reduction for strategies for ACL injuries specifically, maybe some governance and policies around things like match congestion or schedules can change that, or can be helpful if we have more information about how the ACL responds and adapts to cumulative load like that. So going back to risk factors, obviously we said, besides your ACL, maybe research will show that it can be modifiable to some extent. Like you're saying, it does adapt just like other tissues in the body. But going back to biomechanics for a bit, a big part of ACL injury prevention, also rehab, is this idea of training proper mechanics, or cueing, the proper mechanics for things like cutting and decelerating. Common in physical therapy practices, you'll hear comments like land softer, things like that, to try to help reduce the risk of a second ACL injury. So what is the evidence behind those interventions, and can we actually change how someone moves with that type of intervention? What are your thoughts on biomechanics as injury prevention and also a rehab strategy?
I mean, I think they're important. With my patients, I definitely focus on, proper form and proper movement. But I think it needs to be a combination of that movement retraining, but then strengthening too, which I think we all do, but we really have to load up that muscle. So we can do movement retraining, but then it needs to, a person's knee can take, what we're cueing them for in a PT clinic, but how well are they going to be able to decelerate and keep that form when they're on the field at match speed? And so, do they have the quad muscle to support that? Do they have the rest of, like, do they have the rate of force development to do that? So I think they go hand in hand. And I think, you just have to, we have to load these athletes as much as we can within reason, but like we have to build the strength properly.
Yeah, they need to have the prerequisite strength to be able to do the tasks the way that is beneficial or more effective for them. So, from a practical clinical standpoint, how can PTs, coaches, athletic trainers better train cutting and deceleration biomechanics in athletes?
I think we have to. I think we do a good job of starting it in the clinic, but I think the communication between all of those different people that are involved with that athlete's care really needs to be as clear, and people need to work in as much of a team as possible, because as they get onto the field and as they're starting to do that on-field rehab, we really need to make sure that they're continuing to work on those mechanics, and that they're doing it at speed, and that we're watching how much load that we're gradually progressing that, and that all of those things don't get lost as they, go back to the team or as they jump into a drill. So I think that's really important, and it can be really hard with, a whole team managing, how many people at a time. And I get how that goes, but I think it's that last step that is so important. And that's where I think things can get lost in the shuffle.
We've talked about loading a number of times. You've brought up they need to have the prerequisite strength, which requires that we load them appropriately. So now, thinking about how athletes respond and adapt to load, what's some of the research out there in terms of the physiological responses to training in female athletes?
This is, to me, something very fascinating that is coming out, and I think hopefully more research continues to come out about it. But basically, females, we have a greater percentage of type 1 muscle fibers versus males. Now, obviously, this is sport specific, like a sprinter versus a distance runner. Like there's some variability in this, but males and females have the same amount of muscle fibers. But again, males have that higher percentage of type 2, which is the fast twitch muscle fibers. Type 1, which is females tend to have a greater percentage of, are the slow twitch muscle fibers. But what that means is they both have a different kind of metabolic response. So the fast twitch muscles work more with, if anyone remembers from biology class, I used to hate these lectures in biology class, and it's funny that now I have to apply them how many years later. But glycolysis. So that's primarily using an anaerobic form, a metabolic process to produce energy. And we have lactate as a byproduct of that. It takes time to clear the lactate and to kind of regenerate energy to go again. Females, with having a greater percentage of type 1 muscle fibers, they use like an aerobic process, which is a lot easier to regenerate and replenish those stores. So what that means is the recovery time for females, there's evidence that the recovery time in our muscles is quicker than males, and that females, it takes longer to go to fatigue. Now, that's only seen peripherally, so it has great implications for strength training if you're doing single limb exercise or rehab. It is beyond 80% of max voluntary contraction. This difference actually tends to not be as great, so that's something that can have a caveat. But the cool thing is, females probably, we again don't have we have studies that tell us that, but we don't have studies that tell us on the application. But in theory, based on that, we don't need as much recovery time as males do. And all of those, sets and reps, I actually just taught a lecture at John Carroll about like sets and reps and your rest ratios, like 1-2 versus 1-3 rest ratios. Like I love the NSCA, but all of those based off of studies on just males. We don't know what the response is in females. So they may not need as much rest. I do tend to see that actually in the weight room with our high school athletes, but there needs to be better studies where that's quantified and to look at the response on of training with less rest.
And so, other than maybe less rest between sets, what about things like, does that also mean that maybe female athletes can tolerate higher volume of loading in the gym?
Yeah, they likely can because if you're not fatiguing as quickly as males do, you yes. There was a study that looked at like isometric contraction and the males fatigue faster than the females. And so you almost wonder like if we're prescribing sets and reps to, a female athlete, just like you said, like could they do more? Can they tolerate more?
And how important is it for, maybe let's go back to just standard physiology. How important is it to get to failure for hypertrophy strength gains?
It for hypertrophy and strength gains, you want to be at least close to failure. So I mean, technically for hypertrophy, you want your rep range to be higher. So you may be kind of in the like 70 to 80% range. Like I mean, you're thinking like in again, this is based on males, but like 5 sets of 5. So pretty close. You're not right in the 90 to 95% range of somebody's one rep max, but you're lifting heavy. And so I mean you really need to have that load. But also you wonder too, like again, 5 sets of 5, could it be 5 sets of 8, 5 sets of 10? Are we at that same, at 70 to 80% of a one rep max versus, what we typically program 5 sets of 5 at that percentage.
Are there any studies out there now or starting to come out about using different rep ranges or different rest ratios for female athletes and having the same hypertrophy response or strength adaptations as, the standard of 4 sets of 8 to 12 for hypertrophy, et cetera? Like, is there anything coming out and emerging about that?
I, as of now, no. I wish there was. I'm hoping that some of this, this initial work is being followed up by intervention studies like that to be able to see, because we don't have like we have the theory. What I typically tend to do is I tend to start to shorten the rest. Like whatever I would normally program, I tend to start to shorten it with female athletes. So I will either, take like 30 seconds off of it, or like I think you bring up such a great point about like maybe we can do more repetitions and maybe start to inch that up. And then I try to check the response. So, if we're shortening their rest, are they not being able to hit those same numbers? So then, but more often than not, and again, this is purely anecdotal, more often than not, I'm not seeing a drop off. So, I mean, I'm typically shortening again by like 30 seconds. I'm not doing it extreme, but they are able to tolerate that without, again, just being objective and looking at the load lifted, across sets.
And what about something like a strategy of just saying, like giving the athlete a self-selected rest period? So just saying, okay, okay, when you feel ready, go ahead and do your next set. Do you see any differences between male and female athletes with that? Or is that maybe a good strategy that athletes are able to self-assess whether they're ready to do their next set, and maybe the rest time doesn't have to be this kind of arbitrary number?
Yeah, I think that is a good strategy. I use that a ton at the high school. I try to, like, we have a running clock with seconds on it, but they rarely look at that. And unfortunately, I'm only at an all-girls school, and there's not any studies that look at it versus males versus females. But I more often than not, with a good amount of load. So I mean, we're lifting with barbells, and we are putting a good amount of weight on where they're struggling to hit their last. They're hitting with good form, but I know they're tired in their last rep or second last to last rep of a set, and they are ready to go again within a minute. So it's, I do see it, and I don't know if that's maybe more age specific because it's 15 to 18 year olds, but I do see that.
So, other than the difference in ratios of type 1 versus type 2 muscle fibers, what are some of the other physiologic differences that might influence training adaptations in female athletes?
So the our muscle perfusion is different than males. So females have a larger like arterial dilation response, meaning that we can get blood to our muscles quicker than males because we have more, our arteries dilate enough to be able to get the blood in. We have a greater mitochondrial capacity, and so mitochondria, powerhouse of the cell. I always laugh at that meme. It goes around like
Everyone remembers
about
that.
and I always laugh every time I have to teach it in class too. But the mitochondria is where all our metabolic processes take place, but that helps fuel the aerobic processes for energy. And so it goes along with the type 1 muscle fibers. There's greater capillary response, or there's greater capillary density in females versus males. Now, interestingly enough, our lungs tend to be smaller when we're matched for size versus males. So males are better at taking oxygen in, so they have a better kind of central response to exercise where they can get air in a little bit better. But then females are better at shunting that oxygen out to our muscles. So that tends to be when we do like cardio. So when we think of like whole body exercise, there may not be a ton of a difference between males and females. But when we look at, the peripheral exercises, so things that are, strength training, single limb or single joint exercises, or even just like things like squats, lunges, even that are multi-joint, but not using a ton of that cardiovascular response, depending on how many sets and reps you're doing or what speed. There, there's the potential again for, because of those things, less fatigue, more reps, less recovery time needed between sets.
So because there's this kind of higher vasodilation response in female athletes, greater ratio of type 1 muscle fibers, all of this is saying that potentially while female athletes are loading in something like you're saying, like maybe a single joint exercise, or, let's say leg extensions, for example, doing leg extensions or Nordic hamstring exercise, something like that. Maybe because of those things, female athletes could actually do a higher volume of that exercise, and also potentially require less rest in between. And that is one of the bigger differences. Whereas male athletes probably will have a greater intensity of that exercise, of that session. Female athletes could potentially have higher volume.
Yes, that's exactly it.
Are there any other physiologic differences that we know of when it comes to the training response?
There is so it's being looked at in terms of training response, like not so much strength training, but repeated sprint response. It's debatable. So the thought is, and there are some studies that show that females may be able to recover quicker from when you're doing repeated sprint training. There are some studies that don't show that as well. There's not a ton of research out there in general, but the studies that are kind of refuting that are saying that it kind of depends on what power you initially start at. And so their argument is that if males start at a higher intensity and have a higher output initially, there's going to be a higher drop off, just because that's how the anaerobic response is. You have just a larger percentage of drop off from there, versus where if females are starting at a lower initial power, there may not be that decrement. So that's kind of to be seen. There is a study on elite. During a women's friendly, they did muscle biopsies before and at halftime and afterward, which I think is amazing for the women that volunteered to be in that study and doing that at halftime. And it makes sense that it was a friendly, not a World Cup,
not a competitive,
Euros or something like that. But but the glycogen values of the muscle, so the utilization of glycogen in the muscle, females did utilize that. So we are using glycogen. There is obviously anaerobic exercise happening during a match, but the utilization was much less than males, because they compared the data. They compared the data they took during that friendly to a prior study that the group did, where they did the same thing in male athletes. So that was kind of an interesting finding there.
So what would be some implications of that?
I think you can I think you can start to play around with rest and recovery times too for repeated sprint recovery. I mean, we are along those same lines, and it's a matter of like checking checking the response to make sure. So if we're decreasing that, or like in theory, like you mentioned too, along with the strength training, maybe you can add more sprints, maybe you can add more of a volume, just to make sure that we're getting the right stimulus for the adaptations that we need. But then just making sure that are they still able to hit, are you still able to hit the repeated sprints, the subsequent reps at the time goal that you'd like them to be at.
I guess that brings up another good question is I talked recently to a sports scientist in the NWSL about kind of planning the training week and using match data for the athletes to set targets for the week. So as an example, for total distance, and again, most of this research comes from the men's game, but as we're planning a training week in elite women's soccer, you would take maybe around 150% of what their total distance is in a game and plan that for them to get that across the training week. And then for a high speed running distance, it's, anywhere from like maybe 90 to 120%. And then sprint distance, again, like around 90 to 100% of what their match load is, and spreading that across the week. But again, most of that does come from the men's game. So I wonder if, obviously there's not research on this yet, but what your thought, based on the research that does exist and what you do know about differences in physiology and training adaptations in female athletes, maybe there's potential that could be higher, right? Like maybe that could be pushed a little bit more, so there's a little bit more volume across the week. What are your thoughts on that?
Yeah, no, I definitely think that there's potential for that, and just slowly kind of inching it up to see, and just making sure that you can check the response. And it's a nice thing at the elite levels when you have that data and you have, things like force plate RSI scores, or like recovery subjective scores. If the athlete's saying like, I don't know why I'm so much more sore after this practice, or my legs just kind of feel junky for the next couple of days, and okay, then we know. But in theory, yeah, you very much could, because like you mentioned, it's based on males, so we don't know, and we want to make sure that we are training females to the potential that they need to be at. And if we're only giving them part of the stimulus, it's just are we really getting the full potential?
Yeah, so in your presentation over the summer, you talked about, I remember like you flipping to the next slide and it just being like, so are we underloading female athletes? And like you kind of had this great buildup of, like you said today, biomechanical differences are very individual, and that's what it comes down to is we need to make sure that they have it's important, but we need to make sure they have the prerequisite strength. Now, having the prerequisite strength, it's important to know these physiologic differences in how female athletes respond to training so that we can get the most out of it. And then you cut to this slide of, so are we underloading athletes? And I just want to know what your thoughts are on that, and maybe if you could kind of give a little bit of an explanation of potentially why we're underloading female athletes.
Yeah, I mean, I think there's a couple of reasons. I think one is that we don't know the full load, that the full load response. So we don't know exactly how much recovery they need, and maybe they're getting too much recovery. So we can, maybe we can do better on that realm. Maybe we're not at the intensities or appropriate sets and reps. Maybe they can take more that way. And then the other thing is there was a study that was done, and this was, as somebody who works at a high school and works with youth athletes, 61% of women's academy coaches had less than 5 strength and conditioning coaches. So not just coaches, strength and conditioning coaches had less than 5 years of experience. So that's 61%, and then males was 38%. So I just don't think that young female athletes are getting the opportunity to be loaded appropriately. And I think that's what I think that's where when we see those biomechanical issues later on down the line, I think it stems a lot from that, from movement literacy, from loading. I think it's cultural. I think, boys are encouraged to like play and tumble and roll around, and there's loading that happens with that. But like we are not taught to be that way. I can't tell you how many times I have to tell the girls in my weight room, like, it's okay, you can drop the weights. Like, if you're going heavy and you need to drop the weight, but they don't want to because they think they're being rude, and and the other thing is they don't like when everybody turns around and looks at them when you hear a weight banging around. There's those things. That same study showed that only 6% of strength and conditioning coaches used Olympic weightlifting versus 30% of men's coaches. So in our weight room, like, you have to earn the right to do the faster movement. So, that's very dependent on the experience of the athletes that I have coming in. Sometimes we get to that point and then they're seniors and they move on. But I think there's just such a variation in opportunities that female athletes have had growing up. And I think it really, all of that adds to loading as well, apart from the physiological side and the response side that we just don't know.
So, what are some future directions that you hope to investigate yourself in your lab, or that you are currently investigating, or that you just think would be high ticket priority items in order for us to know more about how to most effectively train female athletes?
The one that we're trying to do right now, and if anybody wants to collaborate on this, feel free to contact me. I'd be happy to talk about it. Is trying to do a replication study of there was a study that I found to be really interesting, but it was slightly underpowered. I think some people got hurt or for some reason had to drop out. I can't remember the details offhand, but they had 4 groups. 2 groups were males and 2 groups were females doing sprint training, and 1 female and 1 male group had a rest time that was a little bit longer, and then 1 female and 1 male group had a rest time that was a little bit shorter, and they were doing repeated sprint training. And the women's group with the less time actually made the best improvements out of all 3 groups in terms of speed, and they did it with less recovery. They did better than the group that had the longer recovery. So I'm trying to figure out a way to kind of replicate that in, what teams and logistics, and do we make it more soccer specific, or do we just do, straight repeated sprints, which are soccer specific, but I don't kind of tweaking around that. That's kind of because I think that would give some more numbers to it. The other thing would be, having people in an intervention where you have, sets and reps that are laid out with less recovery or more reps, or, something, and being able to look at the training response versus a control group that way who do the traditional kind of sets and reps, the rest between the sets and reps. We're also looking at some of the things I mentioned with the ACL, because those are interesting to me. And then the last one that is our initiative is we're looking at training age and how that relates to biomechanics. So what we're doing is the goal is to bring in high school athletes, and this is we're in the early planning, like IRB stages of this, but where we can track it over the next few years, athletes of various training ages, and looking at their biomechanics, and looking at how they change as they've been training in a weight room, because these will be high school athletes that are training in a weight room regularly, and how they change, and then again tracking them over time.
And that first study that you mentioned that you're trying to replicate, or that you'd like to replicate, would the primary outcomes just be sprint speed? Would you also look at physiologic responses like VO2 max or heart rate response to that? Like, what would your main outcome measures be?
Initially thought the main outcome measures would be sprint speed, but I think the VO2, the heart rate response, would be a lot. That would be a great data to put with it, because that really would tell us kind of what's going on,
Yeah.
under the hood
Yeah.
there.
Cool. So what would, if there is a strength and conditioning coach who's working with female soccer players listening to this, what would be some of your top pieces of practical tips and advice for training female athletes to maximize their adaptations in the gym, or like you're saying with repeated sprints?
The first one is just to not be afraid to load them. I think that the number one thing I hear in our weight room is like, I didn't know I could go heavy. Like, I thought I wasn't supposed to go heavy. I thought I wasn't supposed to do that. And I don't know who is telling people this, but obviously there's a time, you have to be thoughtful about it. We're not just slapping weights on, but I think the encouragement of like, no, you should, this is how you're going to get better. This is how you're going to be healthier. All those things. I think that's really important. And then starting to, just question that traditional recovery, rest and recovery, sets and reps that we've been taught, and just making sure that you are, you know, that athlete is fatigued afterward. Again, obviously it's training dependent, whatever your goal of the session is dependent, that kind of thing. But did you work them appropriately, and just making sure that, did they have reps in reserve and you just didn't realize, maybe just being more conscious of those things.
Do you use something like reps in reserve while programming for female athletes?
I do, because when I have them, a lot of times we'll kind of auto regulate, where I'll say, like, pick a weight that you can do 8 at. I want you to be tired for the last, 2 reps, but I want them to be doable, but I want you to like feel like you worked. I want you to feel tired afterwards. And a lot of times, because it's a high school population, sometimes they don't understand what that means. So I have to kind of double check afterward, like, how many more could you do? Or sometimes too, the easiest for them is, could you put a little more weight on? And they'll be like, yeah, I could. So then we know that way. And I'm watching their form, and just looking to see, do they look tired afterward, that kind of thing. But I think the reps in reserve sometimes can be very useful.
Yeah. Well, if anyone listening wants to collaborate with Carol on that for a study with the repeated sprints, reach out and let her know. Carol, before I let you go, I do have 2 rapid fire questions. So they're more kind of ad lib, fill in the blank. So the first one is, something I wish everyone knew about training female athletes
Is that we might be able to do more.
great. And then the second one is, my favorite thing about working with female soccer players
Is There's a lot of things. I'm proud of how they do.
they really push
Yeah.
themselves. They're a group that really likes
Yeah. Yeah.
to absorb a lot of learning and take in any coaching and resources that we can give them. Yeah, that
Yes.
is
Yes.
really
Absolutely.
rewarding to see, for sure. Well,
Yeah.
Carol, thank you so much. Is there anywhere that people can reach out to you, learn more from you, connect with you? Where can we direct people, listeners who want to follow what you're doing?
Yeah. I'm on LinkedIn, so you can find me there. Carol Mack. Actually, I think my main name's still up there too. So Carol Furkovic Mack. But there, or Instagram. A lot of times Instagram, I try to post some, work related professional content, but sometimes it's more like pictures of food or sports. But feel free to connect with me on there, and I'd be happy to talk shop.
Awesome. Thank you so much, Carol. I really appreciate it.
Thanks for having me on. It was good. It was good seeing you. Good talking to you.